Okay. Well, welcome everybody. Good evening. Glad to have you here. So glad that you could join us today and join us for this conversation on identifying and coping with stress. My name is Austin Leone, and I'm a social worker operating as the case manager here at the Clearwater Free Clinic. And I'm joined by Shawn Fox. Shawn is a behavioral health volunteer provider here at the Clearwater Free Clinic and holds master's degrees in social work and science, specifically psychology. Shawn is currently working as a professor of psychology and is a registered clinical social work intern, providing psychotherapy to adolescents. Shawn, if you'd like to say hello to everybody and add anything that I might have missed.
No, I think you got it all. Hi, everybody. It's really nice to kind of virtually see you all tonight. I see many people whose names I recognize, whether they're students that I have or even some people at the clinic. I know we have a wide group of people attending today, and definitely thank you, everybody, for taking some time out of your day to learn a little bit about stress, especially as we're going into the holiday season. For those students that I have, hopefully not from me, but you got some stress from ending this semester, I'm sure also. Some patients with the Clearwater Free Clinic that are attending today that have certainly been feeling some of the pressures and stresses. So hopefully we can help address some of that. I do want to mention for those students who are attending, we will take that attendance towards the end of the webinar today, but we'll talk about that when we get into it. We'll share a link so we can make sure you all get credit for that. So other than that, welcome everybody. It's nice to be able to speak with all of you tonight. And Austin, take it away.
Yeah, thank you so much for joining me in this first installment of our webinars. Based on this, maybe we can make this an ongoing thing. So let us know in the chat if you like this format, and maybe this might be something that the clinic continues in the future. So Shawn will be walking us through a few key sections later on, but for now, I'll begin by introducing our topic today. So this session is all about understanding stress, what it looks like, how it affects us, and what we can do to manage it in healthy but realistic ways. So stress is something we all experience, but sometimes we don't realize how much it influences our mood, our physical health, and even our relationships. We talk, we will talk about common signs of stress, how it impacts the body and the mind, and practical ways to build resilience and find balance. So whether you're somebody balancing work, family, or health challenges, or you're in school juggling assignments and responsibilities, the goal is the same. It's to give you tools that you can start using right away. So we'll spend the next hour, around an hour or so together, and at the end, we'll leave time for some questions and further discussion. So thank you again for being here. And just by showing up, you're already taking a step towards caring for yourself. So I just wanted to acknowledge that. Okay. So before we dive into the topic, I did want to just take a moment to share who we are at the Clearwater Free Clinic and why this conversation fits so naturally with what work we do. So the Clearwater Free Clinic is a nonprofit organization, and we provide free medical care, behavioral health counseling, and case management services for uninsured adults who live and work within Northern Pinellas County. Our mission is to make sure that no one has to go without care because of their financial situation or their lack of insurance. We practice what's called integrated care. And if you have never heard of that, that means that the medical providers, behavioral health professionals, case managers like myself, and numerous other specialties work as one team to support the whole person. Doing so allows us to have a holistic approach. We do this because health isn't just about treating an illness, it's about understanding the stress, the barriers, and the circumstances that affect somebody's life. So, as I mentioned, holistic care, that means that we're approaching patient care from a physical, emotional, and social standpoint to bring together a better well-being. So, for example, somebody might come in for high blood pressure or diabetes, but we'll also talk about how stress, sleep, finances, or relationships might be part of that picture as well. So when we care for both the body and the mind, people are going to heal more fully, and that's what we strive for here at the clinic. So, Shawn, do you have anything to add about what we do here at the clinic or any of your experiences here?
Yeah, a few things I wanted to mention. I just know from my experience of being with the clinic, of being associated with the clinic, one of the things that always strikes me is you hear people talk about topics, whether it's on the news, social media. I certainly hear it in classrooms sometimes. We hear it from, friends, from certainly clients, that there's issues with the healthcare system in this country. And good Lord, I could go on a soapbox moment here and talk about all those issues. I'm sure all of the people watching right now have very strong feelings about the healthcare industry in this country. But, when we talk about things like social justice, we talk about things like institutionalized imbalances as far as hierarchies in this country. We talk about all these issues. People feel strongly about it and they talk about it and they identify that there's a problem. And that's great. And identifying a problem lets us know there's something that needs to be changed. That change takes a long time. What does that do for a person right here, right now, that has diabetes, that has hypertension, doesn't have health insurance? What does that do? And we certainly have clients at the clinic who are like this, who have cancer, who have more pressing health issues that really can't be postponed. In those cases, we are talking about life and death differences. And not just as, Austin, as you mentioned, not just treating the cancer, the diabetes, the hypertension, but the stress that goes with that, helping them to maybe find jobs. We do that at the clinic. We have a food pantry, we have physical therapists, we have occupational therapists. It is a comprehensive care and it's not completely free. Clients do contribute in as much as they can. Of course, we also seek donations. And this is the part that I do have to say, this is a free webinar, but please, 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 if you're able to, you can scan the QR code. I'll also put in the chat the link. If you're able to make a donation, we certainly would appreciate any donations you're able to give. The suggested donation would be $5, but you don't have to pay that. If you need to pay more, that's fine also. If you're unable to, a really great way to help us in our mission is just to subscribe to this YouTube channel. Go onto Facebook. We're on Facebook. We're on Instagram. We're even on LinkedIn. By helping us get this message out, you're also helping us with that mission. And it's really important. I know one of the biggest things that I saw when I was at the clinic was a really, really sad story about a young man, mid 20s, perhaps about the same age as many people watching today, that had a congenital defect, had a congenital disorder that led to misshaped muscle cells. And it's the most amazing thing. Like, I've never even heard of this before. From what I heard from the nurse practitioners, because we all collaborate so well together at the clinic, this is a very rare disorder. Right? This is like a 1 in 100,000 people have this disorder. We were able to treat this person because otherwise he couldn't work. He wasn't on disability. What would happen to this young man in his future, in his hopes, uh, if he didn't get that care? And I'd really hate to think about what that could be. So, when you do help us, either by doing those donations or by simply liking us on social media, subscribing to the YouTube channel, you're helping us with that goal also. So I think I got a little bit of a soapbox moment there, Austin. I'm sorry. I'm going to hand
No,
it back over to you to take over.
no, that was fantastic. Thank you so much. It really painted a good picture of what we do here on a daily basis. We're encountering these patients that really have no other resource for them. And so this really meets the need for sort of a gap in between those who are low income to the point where they're provided something like Medicaid or county services, in between those who make enough to pay for insurance on their own. But there's a gap there in the middle of people who work, who provide for themselves and their family, but they just can't afford the expenses of insurance or healthcare. So I didn't realize that our camera on the top right there would block the QR code. So it has been put into the chat for our website with the donation link. So feel free to visit our website if you'd like to learn more. And we'll get into that a little bit more later. So our goal in hosting educational sessions like this one is to further inform our community members about more ways that we can make positive changes in our lives. So, specific to this conversation, when you understand what stress is and how it works, you're in a much stronger position to manage it. So, let's start by talking about what stress actually is. If this wants to work, there we go. So, stress is your body's natural reaction to a challenge or demand. It's how we respond when something feels uncertain or uncomfortable or threatening to us. But here's the key: the amount of stress we feel isn't just based on what happens to us, it's based on how we see and interpret what happens to us. So, as it says here, how we see a situation affects how much stress we feel. And with that, that means that our perception really shapes our response to a situation. So imagine two people in the same situation. Both are running late to work. One person starts panicking. They're thinking, I can't believe this. I'm going to mess everything up. Their heart rate starts rising, their muscles tense, and they feel overwhelmed. The other person takes a breath and thinks, yeah, I'm running late, but I'll get there when I can. I'll call ahead so they know what's going to happen. Their body is staying calmer, and then they move on and they can think more clearly and make better decisions. In the same situation, two completely different reactions. The difference lies in the mindset between the two. So there are two questions that are really great ways to check in with yourself. One, how serious or threatening does this feel right now? And two, what can I do to change or handle it? Like it says here, is this something that could harm me or just challenge me? Or second question, what resources or options do I have to deal with it? Asking those questions slows down that automatic response that we have to these situations that stress us out. And it helps our brains to move from survival mode into more of a problem solving mode, like a more calm mode where we're able to think more clearly. At the bottom there, it says, try to pause and ask yourself, can I view this situation as a challenge instead of a threat? That shift in thinking can actually change how your body reacts to stress. So, for example, instead of thinking, I'll never figure this out, try reframing it to, this is tough, but I can take it one step at a time for our students. Kind of applies to assignments. The small change in how you think about it reduces the intensity of the response you have to that stress. And over time, those little shifts build resilience. So, stress isn't always bad. Sometimes it pushes us to grow, to adapt, or to act. But when stress becomes too constant, it can really wear us down. Learning about how to recognize stress and reframe it is one of the best forms of self care that we can practice. So, now passing it back over to Shawn, can you talk to us about some of the common signs of stress and how to recognize them?
Yeah, absolutely. And I think that is something that's so powerful that you mentioned, Austin, is that, oftentimes we look at stress and we think of it as just being a bad thing, and that the goal is to just remove any stress from your life. And, there's a problem with that. And that, first off, that's just not practical. Like, I hate to break it to you folks. I think me and Austin are pretty good at our jobs. We can't give you a magic lesson in an hour to make all stress go away. But it's also not good, right? Like, you need stress. We need something to kind of challenge ourselves a little bit. So I think what's important here, one of the first steps, then you think, well, how do I know the difference, right? How do I know the difference between the challenge and the threat? And I think one of the things is to first listen to your body. Oftentimes what happens is we get so caught up in our day-to-day routines. We get so caught up in those stressors, whatever they may be. If it's assignments, as Austin mentioned, or if it's like some of our patients at the Clearwater Free Clinic that they may be dealing with stressors because of not having a job, financial burdens, health burdens. The first thing is we get so caught up in that we fail to realize really what our body is going through. And I'm a big one on mindfulness. So here's some common signs of stress and kind of the things to look for that, if you're checking some of the boxes when I go through this, it's probably not the challenge type of stress. This is probably the threat type of stress, right? This is the bad stuff. This is the stuff we need to find a way to deal with. So they include a lot of different things like physical symptoms, headaches, muscle tension, fatigue, digestive issues, upset stomach, diarrhea, acid reflux, right? Those aren't only caused by stress, of course, but they can be. And certainly poor sleep. And that's one that's really important because it's a feedback loop, right? The more stress you have, the worse you sleep. The worse you sleep, the more stress you have, the worse you sleep, and it just gets worse. And in fact, here at the clinic, I mean, I think that's one thing that we kind of tend to overlook. As we mentioned, it's an integrated approach. So somebody has a physical problem. It's not just a physical problem, it's also the mental. Our minds and our bodies are in the same person. So you have to really treat both. Emotional signs, irritability, sadness, anxiety, hopelessness, not just experiencing those, but I think often sometimes, experience them in ways that maybe is out of the norm for you. We all get irritable from time to time. We all get sad from time to time. Heck, that's being a human being. But if it's out of the norm for what you would normally do, that's kind of where you start have to wondering, all right, maybe I'm dealing with some stuff. Also, the levels, right? Maybe something like being stuck in traffic, for me, that's something that's going to make me really irritable no matter what. But, maybe it just kind of pisses me off a little bit. And now all of a sudden I find myself punching my steering wheel and screaming in my car, right? The degree to which that irritability is coming out is totally different. Some behavioral signs, isolation, overeating, and that's a big one. In fact, here at the clinic, we're talking about maybe having that be another component in our webinar series is something like binge eating, problematic emotional eating, things like that, because it's very, very common. Smoking, drinking, and certainly that opens the door for all sorts of different types of substance abuse too, whether we're talking about smoking tobacco, drinking alcohol, or perhaps more serious types of substances. I often say, nobody just wakes up and decides they're going to be a substance abuser. There's something that propels it. And oftentimes it's difficulties with dealing with and managing stress. So the big tip here is notice your body. When it's stressed, what does it do? How does it look? Being able to kind of just reflect, and sometimes it does take just stopping and just thinking, what's happening right now? What's my breathing at? Where's my heart rate at? Am I tense? What does this actually look like? Just taking that step sometimes can be really, really helpful. And now that we kind of covered those physical symptoms, I want to go to this next slide and talk a little bit about how that stress actually starts to affect the body. And this is really critical because, as I mentioned here at the clinic, especially, we look at that mind body connection. And oftentimes, many clients that I've seen at the clinic are really shocked to find out how much their physical ailments are connected to their mental health. And to talk about that, I think one of the big things to really talk about and cover here is really your body's fight or flight response. For some of you, this may be a throwback to high school or even earlier, but your body has this natural ingrained reaction to danger, to threat. We fight, we flee, or we freeze, and all animals have that. My little dog just the other day, walking him at night, and a rabbit came running out, and he froze up. Right? All animals have this. It's a survival mechanism. Your muscles tense up, your heart rate increases, your respiration increases, and your body's way of really saying, like, I don't know what's going on here, but may need to fight, I may need to flee, I may need to do something to get out of this situation. When you have stress, you trigger that reaction. You trigger that fight or flight or freeze reaction. And it's interesting because I just mentioned animals, I talked about my dog. What distinguishes one of the many things that distinguish humans from animals is that animals really only trigger that response when there's an immediate threat. Humans trigger that response not because of just an immediate threat, but what could happen. And you think about it for a second, stuff that really stresses you out, is it really something that's happening in that moment? And is it really something that is a danger to you? Or is it things that you're thinking of that could happen? Or is it things from the past that you just can't get out of your mind and you're beating yourself up over? Even though it's not a quote unquote real threat, a direct danger, it's still triggering that in your body. And the way it's doing that is through the release of a hormone called cortisol. So, cortisol and adrenaline are like the two big hormones that drive your stress reaction. Adrenaline, I always like to say, is like the fuel for the fire. Somebody comes out and jumps out at me and I'm scared. It's that immediate heart racing, breathing heavy, muscles tensing up. Cortisol, though, is the real stress hormone. That's what when people say stress hormone, they think cortisol. What it does isn't that immediate fuel for the fire. What it does is it actually kind of alters the way your body uses energy. Now, without getting too technical on this, it kind of does things that structurally do things like decrease your immune system. Because if you're in a fight, if somebody's threatening you, you don't really need your immune system in that moment. Your digestive system, that kind of decreases a little bit because, well, if I'm in a fight, I don't really care about digesting my food. And I mean, in some ways, this could be gross, y'all, but that's why some people vomit when they get really nervous or do other things, or it comes out the other end. Um, Now, the reason why I'm saying all this is that it's directly connected to your physical health. Your immune system being decreased. Well, have you ever heard of people being stressed, being more susceptible to viruses? Yeah. Something like your digestive system. I just talked a little while ago about how, you know, gastrointestinal problems, acid reflux, stuff like that. Well, it's because your body's actually changing the way it functions. At the clinic, a big one, we see a lot of people who have type 2 diabetes. In the United States, I think the last stat I saw said somewhere in the neighborhood of about 50% of those in middle adulthood and late adulthood have type 2 diabetes or are pre-diabetic. Guess what, folks? When you are under a constant state of stress, your body increases its glucose levels, its blood sugar, because blood sugar is kind of the fuel for the fire. So it's always thinking, well, you may need to run, you may need to flee, you may need to fight. So we got to keep this blood sugar high. And over years and years of your life, leads to an increased susceptibility for type 2 diabetes. Not the only factor, there's other factors, but it certainly is a big one. And for those who do have diabetes, it can be really difficult to manage it if you're under chronic stress. So obviously, there's some real significant issues here that could percolate out physical issues. And that's not even touching on a whole host of mental health challenges. Those who are under chronic stress are at a much higher rate of major depressive disorder, mood disorders, related mood disorders like bipolar disorder, and certainly anxiety disorders. So one thing that I find to be helpful then considering all this, right? And I already mentioned the last one, think, what's this doing to my body? Well, beyond that, then ask, is it worth it? If I am so irritable in traffic that I'm punching my steering wheel and I can feel it, I'm noticing, like, man, I'm feeling red in the face, I'm breathing heavy, my heart's pounding. Is this worth a heart attack? Is this worth me having type 2 diabetes? Is this worth what pressure I'm putting on my body in that moment? And sometimes just reminding yourself of that kind of helps maybe take you a little bit away from that ledge a little bit. So I talked about some of the major effects of your body and kind of how that mind-body connection works. But I think now it may be kind of interesting to go into a little bit more detail about the types of stress that we face every day. So I'll pass it back over to
Absolutely.
you.
Yeah, thank you. That was a great assessment of how stress can impact our body and our mind through those fight or flight moments that we have a response to. So those sympathetic nervous system responses, like we talk about. So bringing ourselves from that sympathetic response into a parasympathetic response, other known as rest and digest, like you said, allows our body to function more normally, our immune system, our digestive system, our cardiac system, all of those functions, really vital. And we'll talk in this next slide here about what this looks like in our community, these effects of stress. So here highlighted are some common stressors: financial instability, caregiving responsibilities, food insecurity, and unstable housing. These are what we commonly see at the Clearwater Free Clinic when we encounter our patients here. So these are real pressures that people face not just occasionally, but every day. And the truth is, when stress becomes a part of your daily life, it starts to feel normal, and people push through it because they have to. Work doesn't stop, the bills don't stop, life keeps moving. But that kind of ongoing chronic stress has real effects on the body and the mind, like Shawn was talking about. So let's talk about acute stress versus chronic stress. So acute stress is the short-term stress. Maybe you spill your coffee on your shirt and you are running late to work, or you get some bad news. Your stress level spikes, you have that sympathetic response, and then it kind of passes and you kind of naturally cope with that and calm down. The chronic stress, on the other hand, lasts much longer. So this is, being the caregiver for a loved one, like I mentioned, or managing debt, or living with a long-term serious health condition like we see here at the clinic, or just trying to make ends meet. The note at the bottom there says chronic stress is more harmful because the body doesn't have time to recover. And that's so true. Our bodies are designed to handle short bursts of stress, but they're not designed to live in constant alert mode where they're constantly looking for threats and constantly reacting like there is a real inherent danger. So that's why support systems matter. When people have access to stable housing, affordable healthcare, or even a community that listens to them, the stress that they're facing starts to become more manageable. And the goal isn't to remove every source of stress, because that's impossible. We're all going to face stress. The goal is to strengthen the safety nets that help people recover between those challenges. And that's a lot of what we do here at the clinic. But we'll also talk more about the specific coping mechanisms that you can use as well. So when we talk about stress management, we're not just talking about breathing techniques or positive thinking, although those are very important, like Shawn mentioned. We're also talking about conditions in the real world. So in our environment, stability, safety, connection, and support with others. So in addition to those more specific coping strategies, I'd like to ask Shawn if you can talk to us about some of the tools that we can add to our toolbox in coping with the stressors that we face so that, like we mentioned, those more acute stressors, we can bring ourselves down into a calmer, more problem-solving mode and sort of combat that chronic stress that can affect us long term.
Yeah, and I think that's really important to look at is, we can't get rid of all the stress. And I mean, certainly people that are watching this right now, you're probably thinking like, look, I got a long list. We all have that long list of things that we would like to see go away. But when we talk about really the coping mechanisms, like how do we cope with stress? How do we actually do the managing part, right? We talked about recognizing what stress is. We talked about the importance of managing the stress, but how do we actually go about managing it? How do we go about actually coping with it? And as we kind of transition and start talking about that, the first thing I want to talk about is really the distinction between the types of coping skills that we refer to. So there's really kind of two main branches or categories when we talk about coping strategies with stress. The first branch, the first category is what we call problem focused coping. So problem focused coping is very direct, it's to the point. If something is causing you stress, you change it. So if my boss at work is being really problematic, is on my case all the time, is always making fun of me or something like that, which isn't the case, right? My boss is totally amazing. But if it were, then maybe a problem-focused coping way of dealing with that would be to go and talk to my boss and ask her, like, hey, look, things aren't working. I need to do something different. This is stressful for me, or quit my job. Now, that's actually the best, quote unquote, best way of handling stress. The problem, though, is that it's not really kind of like realistic, right? Like, y'all, I mean, thank God I don't have a problem with my boss, but I need my job too. I got a baby that I need to feed. I can't just quit my job because I'm having problems. I can't just drop out of school because things are getting a little bit difficult. Certainly, those clients that we have watching us now, and the clients we have at the Clearwater Free Clinic, they would probably love to just say, well, yeah, this diabetes, this cancer is just causing me too much stress. I'm going to stop having it. Well, if they could do that, they would. So this brings that second category, right? Which is emotion focused coping. Emotion focused coping doesn't really change necessarily the situation itself, the cause of the stress. What it does is it helps you better manage your reaction to the stress. Now, that includes a lot of things that people think of with coping skills. Things like deep breathing, mindfulness, you can put on here gratitude, prayer. I can tell you there is dozens, if not hundreds, if not thousands of different coping skills you could develop. Some of those are just designed to help your body better deal with it, help your mind better deal with it. Some of them are just distractions. And it's very personal and individualized. I know I'm a huge fan of meditation. I've talked to clients, I've talked to students, I've talked to friends. You should try meditation. For them, it doesn't work. Develop what works for you, but find several different things, right? And that's key. Variety is the spice of life. When we talk about stress management, you can't just rely on one thing because what happens is you just get burned out from it, right? It doesn't have the effectiveness. So I always say, like, have a lot of different tools in your toolbox. Now, when we're talking about stress management as a whole, it's a little column A here and it's a little column B. You need some of the problem focused coping. And as a counselor, I can tell you sometimes when clients come in, we do talk about things like, okay, if you have stress in your relationship, what do we do to address that stress, to communicate better with your partner, to your kids, to your parents, to whomever, right? That's problem focused. But, sometimes when we're talking about those things we just can't fix, that isn't easily fixed, or that you just kind of have to suck it up, those emotion focused coping skills are oftentimes better. Now, one really important thing to note, though, is the role of resilience in stress management. So sometimes that's a term that a lot of people don't really understand fully, but what we're using the word resilience for here is your ability to adapt and recover from challenges. Life is all about challenges, it's all about change. And what I've noticed is a lot of people really struggle with this because the way of looking at it is sort of like if there's a reason for me not to succeed, then that's the reason, and I don't have any guilt over it. Oftentimes what it is a reflection on a person's own view that they can have some kind of influence in their life. And the reason why I'm saying it like that is that sometimes people based on their past don't have that. I've seen it with clients that were horribly abused and traumatized as children. They learned the lesson pretty early on. I can't control my life because I haven't had control over my life. A lot of the clients we have at the Clearwater Free Clinic have felt that even though they may not have had trauma just from their medical conditions, if I can't even trust my own body, how do you think I can trust my mind to deal with stress? And what's sad is that they learn the opposite of resilience, right? They give up. And that's unfortunate because you cannot control sometimes the diseases you get, the disorders you get. You can't change your family. You can't change the background that you come from. God forbid, if you experience trauma, you'd probably love to forget some of that and move beyond it, but you can't. But what you can do is learn from those lessons and to find better ways to respond to those challenges moving forward. And that's where the resilience comes in. And that's why it's so important when we talk about stress management, especially. Now, this isn't something that always comes naturally. I'd love to wave a magic wand and just say, boom, you have resilience. It's a skill. The way I like to kind of explain it is, I haven't been to the gym in a while. I'm not going to share how long. It's kind of embarrassing. But I go back to the gym and I start lifting weights. I'm not going to start bench pressing 200 pounds out the gate. I'm going to get hurt, right? I got to start small and I have to build up to that. So maybe it's like 50 pounds, maybe it's even 40 pounds. I'm going to really embarrass myself. I'd probably start at like 30 pounds, right? But if I build up over time, I'm building that skill, I'm building those muscles, and I'm going to be better able to deal with it. Resilience is the exact same way. Now, some other things here, and it helps with resiliency. It also helps with stress management as a whole, is that it's strengthened by support, it's strengthened by self-care, it's strengthened by having connections. Sometimes resilience can be really fostered just from talking to somebody else and hearing from a friend, like, hey, buddy, you got this. You're good, right? I know you're stressed out. I'd be stressed out too, but you're good. You have what it takes to deal with it, right? Or from family who can do that. And in fact, those strong social ties, we've seen this time and time again. There's actually been tons of research done. I'm going to geek out a little bit here. If you all want to fall into a rabbit hole tonight, look up blue zones. They're areas of the world where people live well into old age, and they live well into old age, right? Like they're living full lives. These aren't people in nursing homes, rotting away. These are people that are living in their homes, have active family lives, social lives. Some of them still work at like 90 and 100. And one of the things they found, and these zones are spread all throughout the world, A couple things that connect it, some stuff out of the topic from today, like, diet, nutrition. But one of the big ones that really unites all of these zones is that they have a strong sense of community. And that community could be anything, right? It can be family, it could be religion, it could be the neighborhood they grow up in. In some cases, it's more like isolated groups of ethnic minorities, but they have a really strong connection. That sense of social connectedness, however you get it, is really important in adding to that resilience and decreasing stress and decreasing the effects of that stress. So definitely something that's really important. So the one big tip here, right? It's okay to start small. Use that analogy I just said, right? If I go to the gym, you go to the gym, you haven't lifted weights in a while, you're not going to knock out the big weights, right? You're not going to be impressing people. You have to start small and build on it. And guess what, folks? Early on, you may have some setbacks. That's fine. That's part of the process. And the more setbacks you have and the more you're able to recover from them, you're building that resilience. Uh, Keeping with that, I think it's a good little transition, though, to kind of go into greater detail about specific types of things that we can actually implement in our everyday lives. So, pass the floor back over to Austin.
Yeah, thank you so much, Sean. And I'm with you there on the gym thing. I should start taking some small steps towards going towards that as well. So let's talk about some of those specific steps that everyone here can start taking to really build up their resilience, like Sean talked about. So the first point says to identify triggers and plan healthy responses. So that means paying attention to what tends to set off your stress. Maybe it's rushing in the morning. I know that's something I do, rushing to work in the morning, certain conversations or financial worries, and planning ahead, sorry, for how to respond to those situations. When you know your patterns and what you um, react to and how you react to them, you can interrupt that sort of cycle before it starts to spiral. So next, we talk about building consistent routines. So consistency gives the brain a sense of stability and control. Even when life feels unpredictable, simple things like a regular sleep schedule, eating at the same time, or setting aside 5 minutes of quiet time each morning can make a big difference. And in our busy lives, something like setting aside 5 minutes may seem like a huge task to some of us. But really, if you think about it, waking up 5 minutes earlier means going to bed 5 minutes earlier, and you're giving yourself 5 minutes to really ground yourself before you rush to work. Maybe even wake up at 5 minutes earlier than that so you don't have to rush to work. Maybe I'll take note of that. So then we see set realistic goals, and that small steps add up. So it's easy to get overwhelmed when we look at the big picture, right? For our students here, you're looking at the final when it's only the second week of class and you're like, oh my gosh, how am I going to do that? I'm going to fail it. Well, if you really think about it, breaking up those tasks or that huge assignment into small, doable steps helps you to feel more productive instead of paralyzed like you can feel. I'm a student too. I feel paralyzed at some of those huge assignments. So it's better to just do it later because, I'm not only am I gonna is it gonna be easier later, but I'll feel forced to do it later. So instead of doing that, if we take little bite-sized pieces of it, we're not going to feel that sort of paralysis by it. So maybe that's handling one phone call today or one assignment today instead of five, or focusing on one task before moving on to the next. So that applies to our health problems as well. As a case manager here, I work with people on managing multiple complex medical problems. And sometimes you can't focus on all of them at once. Sometimes you can only focus on one thing at a time, like starting in counseling to talk about your anxiety before you start treatment for diabetes, because maybe your diabetes is being caused or contributed by the amount of anxiety you have, which causes you to binge eat or something like that. So the next step is taking those short breaks, like we talked about, those 5 minute or less little breaks to really ground yourself. Stress will build up throughout the day, so this isn't just something you're doing in the morning. These small pauses can release that stress that builds up before it peaks, before you reach that point of the fight or flight mode that you get into. So even taking a minute to stretch, to step outside, or take a deep breath, take a walk around the building, those can really reset your nervous system. Like I talked about, going from sympathetic over to parasympathetic, rest and digest, allowing your body to feel more calm. And that'll benefit you in the long term. So finally, when it says replace avoidance with positive action. So what this means is we put off all the things that stress us out, like I talked about, the big assignment at the end of the semester. That's human to do. It's normal. But avoidance is keeping that stress alive. Instead of just keeping it there, try doing one small action that moves things forward. Now you have one less part of it to stress about. Even a small step helps your mind to relax. So the line at the bottom there of the screen, I think, sums it up perfectly. Stress is unavoidable, but suffering doesn't have to be constant. We're all going to encounter stress, like we keep talking about. It's going to happen. We all know that. It's going to happen tomorrow or the next day, but you don't have to continue suffering with that and just be held down by it if you're taking these small little bite-sized pieces out of it, or you're taking these breaks to calm yourself, ground yourself in between these stressful situations. So now let's talk about when the stress gets too much. How do we get help there, or when do we ask for help? So sometimes life just gets really heavy, even when we're doing all the right things, taking care of ourselves, trying to stay positive. There are moments when it's just too much, or it feels too much, either one. That's when it's time to reach out. As it says here, ask for help when stress starts affecting things like sleep, appetite, or relationships. The relationships ties into the social supports and the social connection that Shawn was talking about. And your sleep and appetite are those more physiological symptoms that we face. And that's something we focus on in the holistic care that I was talking about here at the Clearwater Free Clinic. Notice when your body feels hopeless, numb, or disconnected. We call that disassociation. When you start to feel those things, those are your body's way and your mind's way, because they work together, of waving a red flag saying, I need some support right now. So asking for help doesn't mean you failed, just means that you're taking the situation seriously and taking a positive step. So just like you tell your doctor if you had a broken bone, or you'd go to the doctor or the hospital if you had an infection or you needed a splint or something like that. Your emotional health deserves the same kind of care and attention. But that is kind of countered by the stigma that we face, where we don't treat our stress or our anxiety or our depression something like a broken bone, because it's kind of harder to conceptualize because you can't see it in front of us. But if you start to understand sort of the mind body connection that Shawn was talking about, you can really start to notice those effects that stress is having on your life. So the help that you can ask for can take place in many different forms. It might be something as simple as talking to a trusted friend or a family member, reaching out to your doctor, joining a support group, or connecting with a therapist. Sometimes it's simply sharing what's been weighing on you with somebody that you can trust, and realizing you don't have to carry that thing alone anymore. Even one conversation can be that turning point where it's something that is holding you down to something that you can better manage. So if you've been feeling overwhelmed for a while, or if stress has started to change the way that you live your daily life, consider that as your sign to start taking action. Maybe not tomorrow, maybe now. Maybe not when we think once things calm down, or once this situation is done, once I have this figured out. But if you think about it, that's just putting it off the same way that I've put off that school assignment. If you start to take those small steps now, that stress is going to be less later on. So just a small action can really support your mental health. So when you decide that it's time, to get help if you ever feel like you need it, here's where we can get that support. So if you are a patient here at the clinic, that means asking your provider, your doctor, your nurse practitioner about a referral to behavioral health, maybe to speak with a counselor or maybe to start taking psychiatric medications to help us cope with that stress. Um, if you're somewhere where you're not a patient here at the clinic, listed here are a few great resources that are available right here in our community. All of them are free or low cost and open to anyone who needs support. So, one of the best places to start that I recommend to all of my case management patients is called findhelpflorida.com. This is a website that connects people with thousands of programs across the state, but you put in your zip code and you can search for things like food pantries or rental assistance, utility bill assistance, transportation, healthcare resources, counseling services, all of that's available in your local area based on your zip code. So it's a simple tool, but for many people, it becomes the bridge between struggling silently and getting connected to the right kind of support or community, like Shawn was talking about. So another option there is to call 211. So this is a number that you can dial right from your phone 24 hours a day. And when you call, you are connected with a trained specialist who can listen, understand your situation, and help you find local organizations that might match your needs. This is another resource that I commonly utilize with my case management patients. So whether you're trying to pay for a medication or find childcare, or you just need somebody to talk to, 211 can help guide you to that right place. So switching gears into something more, a little more serious, if you're someone ever feels like things are getting too heavy, maybe like you're starting to feel like you're in crisis, maybe you're having thoughts of hopelessness, you're having thoughts of harming yourself or somebody else, or if you just don't feel safe, spread the word to everybody you know about dialing 988 because it's kind of a new thing. Not everybody knows about it. So 988 is the equivalent of 911 for medical emergencies for behavioral health emergencies. So it is the suicide and crisis lifeline. And it's really important that you and everyone you know is really aware of this resource. It's available 24/7, completely free, and it connects you right away with someone who can help listen to you, help you de escalate the situation, and maybe connect you to local resources. It's not just for emergencies. It's also for those moments when you feel like you might be reaching your limit and you need somebody to talk to, and there's nobody else around. So, beyond those national and statewide resources, like I talked about earlier, our community also has organizations offering mental health counseling, like we do, support groups, food banks, family resource centers. Those are all places that you can get help with job training or transportation, legal guidance, or even I've seen pet care out there as well, or free pet food. So those are for people who are going through those tough times and need that additional support. So you should visit findhelpflorida.com or call 211, like I mentioned. Those are the two places that I really direct people. If you need help, you know what that help is, and you just need the information to get it. So the most important thing to remember is you don't have to go through that stress alone. There are people and there are programs that are ready to help, but they can only help if you take that first step, that first small step. Maybe you're not at that point where you are ready to ask for that help yet, but maybe the first step is just asking yourself, like Shawn talked about, what is my body feeling right now? That might be that first small step. Going throughout your day tomorrow, that might be throughout the day, just checking in with yourself. What am I feeling right now? What is my heart rate elevated? What does that mean? What just happened? Start thinking about these things and start learning about yourself and how you react to things. Because how you better build up that resilience is by better understanding your reactions, like we talked about earlier. So whether it's visiting a website or making that call or talking to somebody you trust, it's a sign of strength and self-awareness, not weakness. So support exists for every kind of challenge, financial, emotional, physical. You can find help with anything. There's no shame in using that help either. So um, now let's move into if anybody has, yes, I'm also seeing USF also has food pantries. That's a great resource as well. I'm not sure if that's on Find Help, but if not, I'll definitely look into making sure that's on there, because I'm sure that that is great for uh, students as well. So let's move into if anyone has questions. I've seen a couple that I'll scroll through. Let me see here. If you have any that you wanted to specifically answer, Shawn, you can go ahead and feel free to do that. Just going to find one.
I know one that I saw in there that I thought was pretty good. Carmen, you asked it a while ago, but what Carmen asked was the relationship between chronic stress and post-traumatic stress disorder, which is really interesting. So, really, when I hear post-traumatic stress disorder, it's really a response to an acute stress. So, something that really triggered that fight or flight response in a very severe, profound way, right? What happens is PTSD isn't just experiencing that, it's then the kind of associated symptoms that come along afterwards. So that's usually difficulty sleeping, what we call really heightened startle response, where you're kind of always on edge, and variety of different symptoms that then continue for at least a month after that stressor. So it's not so much chronic stress. However, I love that Carmen asked that question because chronic stress certainly plays a role in perpetuating that. And you think about it, if I'm always on edge, I'm constantly thinking there may be a danger out there. Um, that is stress in and of itself. And it's kind of like changing your behavior and kind of perpetuating those symptoms a little bit. So that's kind of a really good question to learn. But yeah, usually with PTSD, we're talking about an acute stressor, but not just any acute stressor. We're talking about a traumatic event, right? Something really significant. And then the associated symptoms that continue after that. I think I also saw a question on there about the difference between self-soothing versus coping, which I thought was really interesting also. I mean, I kind of wanted to get your feedback on it. Awesome. My way of looking at it, they want to know what the difference was. Self-soothing, I kind of look at it oftentimes as being more of an awareness of your body and trying to calm down the physical symptoms, whereas coping can oftentimes be kind of a distraction. But I don't really know
Right.
if there's a real definition for that. What were your thoughts on it?
So kind of how I would look at it is really similar to what you mentioned of um, self-soothing almost seems like a form of coping, like we talked about um, the difference between emotional and the problem-focused coping skills. It kind of seems like it's a somewhat of a emotional coping skill, but it's one you're doing physiologically or with your body to address those sort of feelings that you're having. So I would almost say that self-soothing, sorry, is really a form of coping with emotionally with the situation. So if that situation, the stress involved with it becomes that it raises to a level where it's too much, sometimes our natural reaction or sometimes we practice self-soothing techniques to really allow that stress to come down to a more manageable level, like we talked about. And it really is part of that, like we talked about, going from a sympathetic nervous system reaction, really calming ourselves, understanding that the stress we're facing is not fight or flight. It's not a life or death situation. Bring ourselves into that parasympathetic mode of resting and digesting. Sometimes that takes communicating with our body physically. So something like mindfulness is a technique that I recommend everybody look into. Of It's really a practice of meditation is a type of mindfulness where you're taking a minute in silence to, um, or there are other types where they involve humming or other types like that. Really understanding what your body is facing and what it's doing. Um, like I talked about, noticing that high heart rate or the high blood pressure, you can feel it. Um, Understanding what your body is experiencing, and then making steps to connect your feeling of safety emotionally with, now I need to convince my body that I'm safe. Or sometimes it's the other way around, where your body knows it's safe, it's in a safe environment, but your mind is sort of that overthinking or the anxiety. Sometimes you need to really bridge the connection between those two. And I think that self-soothing, to go back to that, is kind of one of those ways that people connect their mind and their body to sort of cope with that stress.
So I'm going to change my answer. I liked your answer better, Austin.
Oh, no, I kind of went all over the place with mine, but I did see, so that link for the extra credit for all the students that attended. Thank you so much for attending. Go ahead and fill that out, so you can get your extra credit. That's awesome for you guys. And then let's see, if there wasn't anything that you noticed, we're at our time here.
Yeah, I think that was it. I know one person mentioned something about like they don't realize they're triggered until they start eating Cheetos. And I think it was just something that I kind of it reminded me to talk about, which is that, oftentimes like finding coping skills isn't really so much the problem. Oftentimes what it is finding the right coping skills, finding the right way
Right,
to manage
right,
stress. We have people who certainly manage it through addictions, who manage it
right.
through anger issues, bad ways, right? Leads to more problems. So yeah, definitely recognizing them and kind of taking these steps, I think is important to find the right way of managing that stress.
Right. And I just saw it in the chat as well of, I just can't seem to, somebody said, I just can't seem to calm it down. Well, like Shawn just said, there's so many different ways. Maybe you just haven't found the one that works for you yet or works for this situation. So I really would encourage you to keep looking into different ways of doing that. Try new ones or go back to ones that worked in the past. And as your situation changes, your need for those coping skills may change as well. So to before we wrap up here, I just wanted to take a moment to sincerely thank you all for being here today. But you should also take a second to acknowledge what you did here for yourself. We know how life gets busy, and taking an hour of your day to learn about something like stress, it's not a small thing. It shows that you care about your health and your well-being, and that's a very important first step. So you already took that small step already. So let's continue that. If there's one message we hope that you'll take away from this session, it's that while stress is going to happen to all of us, like we talked about, it can be manageable and it can even be beneficial. Every one of us experiences it. What matters most is how we respond to it and who we can lean on, um, and finding that additional support when it starts to feel overwhelming. So, as you go about your week, remember, managing stress isn't about being perfect or calm all the time. It's about learning to pause, to breathe, and to remind yourself that you have the tools and the support to get through those difficult moments. And as a closing thought, if you'd like to learn more about what we do or how to find access to our services, you can visit clearwaterfreeclinic.org, also on the QR code there, or you can call us at that number provided there, as that's our main line. And even if you're not in need of services right now, you can still be a part of our mission. Share what you learned today with somebody else. Talk about who we are and what we do, what you learned today. Share it with a friend or a neighbor or a coworker, because sometimes just having that conversation about stress can make it feel less overwhelming for not only yourself, but also for somebody else. So on behalf of everyone here at the clinic and from both Shawn and myself, thank you again for spending your time with us. We hope you leave today feeling more aware and more equipped and a little more hopeful about the ways that you can take care of your mind and your body. Take care, everybody, and remember, you don't have to manage the stress alone. So thank you. And thank you, Shawn.
Thank you, Austin. Thank you, everybody. Have a great night.